When you hear about children being abused, neglected, or experiencing severe trauma, how does that make you feel? Do you feel sadness, anger, a desire for justice, or do you struggle to know how you're feeling at all? As adults, many of us struggle with this topic. But imagine you're the one experiencing the trauma, abuse, or neglect, but no longer as an adult, as a child. You no longer have the life experience or maturity to process what's happening to you. And you may lack the emotional support of a caregiver because your caregiver may be the one causing you pain. In this scenario, how would you feel and how would you respond? For many of these youth, they struggle to manage their emotions, process environmental stimuli, and regulate behavior. Their symptoms can often mimic those with ADHD and those on the autism spectrum. They may demonstrate hypervigilance, constant movement, or difficulty focusing. They may be emotionally withdrawn or have behavioral outbursts that seem extreme compared to the situation. This can lead to all sorts of issues for these youth in school, at home, and in the community, now and in the future. But there is hope. Emerging research shows a benefit for using sensory-based interventions with youth with severe trauma. It fosters emotional regulation, cognitive functioning, interpersonal skills, and overall behavior. In the area of occupational therapy, sensory-based interventions are a large area of practice already, primarily in the school system and in working with individuals with ADHD and autism. There's also evidence for use of equine-assisted programs for individuals with ADHD and autism. Various disciplines, primarily in the areas of psychology and social work, have shown benefits to using the horse as an intervention tool to address symptoms found in individuals with these diagnoses. However, there's limited research looking at the use of an equine-assisted program for youth with severe trauma in occupational therapy using a sensory-based framework. The purpose of my qualitative study is to analyze the use of equine-assisted programs for youth with severe trauma. My hope is that through this various stimuli experience during interaction with the horse, such as movement and touch, repetitive tasks during grooming, and other stimuli like smell, sight, and sound, these youth will show improvement in emotional regulation, cognitive functioning, interpersonal skills, and overall behavior. To assess these areas, I will be conducting in-depth interviews with program staff and parents regarding the participants' performance at home, school, and in the community. I'll then analyze the data to determine if there's a basis for a theoretical model to describe the nature of equine-assisted programs specific to the health and well-being of youth with severe trauma. If a model emerges for this form of intervention, it could greatly benefit this population and further this area of practice in occupational therapy.